All right, so in this section, we're going to dive into it. We're going to go through the stages of shock again, so we get a really good understanding on the severity of shock. So when we start talking about shock individually, the different types of shock, cardiogenic, obstructive shock, each one of them, you can see how the shock will progress to the point from people being very healthy and dealing with shock okay, and to the point where you're looking at cardiac arrest. So through the stages of shock, the first one I'm going to talk about is usually the asymptomatic. Basically, it's a person that is totally healthy. There's nothing wrong with them, so you understand what normal would be. The next would be is the change of behavior is usually one of the first signs of shock. These are the people who feel a little restless, feel a little anxious, or they just don't feel right. Then we got compensated shock. Basically, it's your body working together to maintain that perfusion. The next is decompensated shock, is where that compensation, where the body's working, is starting to now fail. And basically, reversible shock, when we look at it, is just complete failure. So what we'll do is we'll dive into one of these individually and get into it in the next one.